when do we know that, yes, this is the time that I have to go and consult a neurologist specifically?
Okay. So in neurology, we deal with multiple things. Like we deal with the brain, we deal with the spine, we deal with all the nerves, like all the cranial nerves, we say the nerves which arise from the brain, and the spinal nerves which goes down.
Correct.
So all these nerves, so they have very specific localization in brain. The center is in the brain. Okay. So if you are having any symptom which is like new onset, if you're feeling new onset numbness in your body anywhere, and if that is especially sudden onset. So sudden onset numbness or sudden onset weakness of one limb of your body or maybe one side of your body. So that is something very alarming. That could be stroke.
Oh.
If you see anything which is like sudden onset abnormal body movements, like abnormal movements, uprolling of eyes and some frothing from your mouth, and you lose your consciousness. So these symptoms like frothing, losing consciousness, sudden onset fainting, or sudden onset dizziness even.
Okay.
So anything which is sudden onset.
Sudden onset.
So it's very precise. Sudden is like within seconds or minutes. So if you see anything which is sudden onset, that is very alarming. You should never ever ignore that.
Okay.
So neurology, sudden onset is like, those are the things which we can save if you come to the hospital within time period.
Okay.
Like stroke, if you get ischemic stroke within like 4 or 4.5 hours of time period, we can thrombolize and dissolve that clot. And that, saves your stroke is like when you get one side of paralysis of body or maybe some facial damage, sudden onset. If we give the medicine on time, like within that time window period, we call it a window period. If we give that dissolution medication within window period, we can save the life, like long morbidity. Otherwise, you could be bedridden or dependent on bed for years, or maybe who knows, like vegetative state, you can go into vegetative state. So those things, anything which is sudden onset, anything which is very new and very severe in intensity, like headache also. New onset headache, very severe after the age of 40. It's never ever ignore that. Any sudden onset abnormal movement in body or any abnormal movement in body associated with some frothing or some bleeding from mouth, that could be seizure.
Oh, yes.
Epilepsy signs. So we should not ignore that. Any sudden numbness, it could be, we call it GBS. Okay. Your body, very acutely goes into paralysis. It starts with the lower limb, goes to the trunk, upper limb, and then your whole body. You cannot move, you cannot say, you cannot blink even your eyes. Okay. Those things, and that happens within like few hours sometimes. So anything which is sudden onset, I would say you should not ignore it. Just go to the doctor. If it is a normal thing, then it's normal. But sometimes, especially in the older age group and in the kids, we ignore those things. We are like, okay, it might be just because of fatigue or who knows, maybe let's go tomorrow. And that, that
is out on the time. Yes.
That window we are losing, and we are losing neuron, we are losing our brain.